Every day, up to half the world's population is at risk from malaria. Malaria is caused by a parasite transmitted through mosquito bites. The parasite causes illness by destroying red blood cells, which without treatment can result in anemia, brain damage and death. The good news is malaria is preventable and treatable, and there is a growing campaign to bring this deadly disease under control.
I'm very optimistic that we can make real progress on malaria. We've seen the number of people dying of malaria reduce significantly over the last 10 years. There are also new drugs, new medicines on the market, new ways of tackling and treating malaria, and potentially a new vaccine that could be developed and that could be used to help prevent malaria in the future.
The fight against malaria is going so well at this moment because of political will, partnership, increased financing and country ownership. And progress has been seen now in countries with increased coverage with all the interventions.
Malaria still kills a child every 45 seconds. We've made great progress, but there's much more to do. The fight against malaria begins with prevention.
We've got two major technologies. We've got insecticide-impregnated bed nets, such as this, where we've got an insecticide impregnated into the fabric of the net. If you get young children sleeping under this, you can actually reduce child mortality by up to 50% in many places. We've also got indoor residual spraying, where you're spraying insecticide inside the houses, and again you can reduce transmission to the same levels with that technology. These two technologies between them save hundreds of lives every day in Africa.
Nets like these cost around £5 or $10 each to buy and deliver, and last about 3 years. But their future effectiveness is dependent on research to stay one step ahead of the mosquito.
The mosquitoes that transmit malaria will develop resistance to the insecticides that we've got, and we will need to develop new insecticides to combat that resistance.
Potentially, there's another way to help prevent malaria in the future by finding a vaccine.
Just think of smallpox, gone, thanks to a vaccine. We don't have a vaccine against malaria yet because we're dealing with a much more complex bug, a parasite, much more complex, that has been around for millions of years, playing around with the immune system.
Advanced trials of a potential vaccine are now underway in Africa. Researchers are hopeful this could help halve cases of malaria.
If everything goes well in the last trial that we are doing, WHO should be in a position to recommend the vaccine in 2015. So that means we are within 5 years of getting access to that vaccine.
A successful vaccine would be an exciting new addition to existing tools, but not enough by itself to beat malaria. People will need to continue to protect themselves with nets and sprays, and if they fall sick, get diagnosed and treated.
Well, the only way to know you have malaria is to get tested. To do that, you need a test which can detect whether you have parasites in your blood or not. A rapid diagnostic test is a very simple test using a plastic cassette like a pregnancy test. A village health worker with very little training in a remote village can successfully use these to determine who in that village has malaria and who hasn't. So they're a revolution in managing health and fever in malaria-endemic countries.
There are an estimated 225 million cases of malaria each year, with over 2,000 people dying every day. Testing and treating malaria cases quickly and effectively is vital. We have effective medicines, but as with all these tools, the challenge remains getting them to everyone who needs them when they need them. Current medicines, like insecticides, also face the challenge of resistance.
It's important to keep developing new medicines against malaria. The parasite changes over time. Therefore, what we need to do is have drugs that stay ahead of resistance and address the challenges that the parasite can face. So, because the parasite itself is not static, nor can our efforts be static, we need to constantly improve the tools we have.
Today, we have the means to prevent, diagnose and treat malaria. But we must expand and sustain efforts to reach everyone in need. We must also keep investing in new ways to continue the fight against this evolving disease.
We need research. We need more tools. We need new tools. And it is why research and development is underpinning all the strategies we have to fight malaria.
There is no single magic bullet that will defeat malaria, but by working together, we can stop people dying from this deadly disease.